Welcome to this learning module on fall prevention, brought to you by Educare, a division of Mirabel Management. I'm Jean Howell and will be your facilitator for this module. I have more than 35 years experience as an RN working in assisted living, home care, clinics, providing case management, and assisting in a drug trial for a large pharmaceutical company. At the conclusion of this training, you will be able to recognize a reportable fall, be able to identify modifiable and non-modifiable risk factors for falls, and you will understand the importance of an ongoing fall risk assessment for every client. I wanted to name this module Fall Prevention in 10 Easy Steps, but I soon found out that while the steps may be simple, for many elderly folks they are not easy. And then I realized that I probably couldn't cover all I wanted you to know in just 10 steps. Let's start with a medical definition of a fall, which is different from a slip or a trip. A fall is loss of upright position that results in landing on the floor, ground, or an object of furniture. And here's another one. A fall is a sudden, unintentional change in position causing an individual to land at a lower level on an object, the floor or the ground, other than as a consequence of a sudden onset of paralysis, epileptic seizure, or overwhelming external force. I like the first definition. It's a lot simpler. Here are some definitions of a reportable fall. Client lost their balance and was lowered to the floor by the staff. Another one, client fell to the floor, but there was no injury. Client was found on the floor, but the means by which he or she got to the floor was unwitnessed. Another, client rolled off a mattress that was on the floor. And last, a fall has occurred in the past 30 days and/or fell in the past 31 to 180 days. The next few slides list some of the major causes of falls of older adults as reported by the Minnesota Safety Council and the CDC. Falls are the leading cause of injury among individuals who are 65 years of age and older. Each year, 1 in every 3 adults age 65 and older falls. Muscle weakness is the leading predictor of risk for falling. Inactivity increases the risk of falling. Exercise that improves your lower body strength and balance reduces the risk of falls and fall-related injuries, and that's according to the CDC. And over half of the falls take place right in the person's home. Of those who fall, 20 to 30% suffer moderate to severe injuries, such as lacerations, hip fractures, or head traumas that reduce mobility and independence, and increase the risk of premature death. 1/3 of the older adults who fall sustains a hip fracture, is hospitalized, and dies within 1 year. The most common fractures are of the spine, hip, forearm, leg, ankle, pelvis, upper arm, and the hand. People age 75 and older who fall are 4 to 5 times more likely than those age 65 to 74 to be admitted to a long-term care facility for a year or longer. By the year 2020, the estimated annual cost for fall-related injuries for people age 65 and older is expected to reach $43.8 billion. Men are more likely than women to die from a fall. The fall rate back in 2009 was 34% higher for men than for women. Older whites are 2.4 times more likely to die from falls as their black counterparts. White women have significantly higher hip fracture rates than black women. Rates also differ by ethnicity. Older non-Hispanics have higher fatal fall rates than Hispanics. I know this is a lot of data, but I want you to get an understanding of the enormity of the problem of falls among the elderly. These are the folks you are taking care of every day. Fortunately, falls are a public health problem that is largely preventable. Many people who fall, even if they are not injured, develop a fear of falling, and this fear may cause them to limit their activity, which leads to reduced mobility and loss of physical fitness, and in turn increases their actual risk of falling. What words would you use to help solve this problem? Physical activity? Get moving? Keep moving. As part of an exercise program, it's important to focus on increasing leg strength and improving balance, and that the exercises get more challenging over time. Tai Chi programs are especially good, and many will benefit from yoga. It's advisable to ask their doctor or pharmacist to review their medicines, both prescription and over-the-counter, to identify medicines that may cause side effects or interactions such as dizziness or drowsiness. Inquire about using vitamin D as a supplement to prevent fractures, especially in older women. And there is more. Here are further things that an elderly person can do to reduce their chances of falling. Some things in the environment around us we can change to decrease the likelihood of falling. Some we cannot. We call the things that we can change modifiable, and they are listed on the slide. I think they're self-explanatory. Clutter in walkways, no stair railings or grab bars, loose rungs, dim lighting, wet floor, floor glare, monochromatic color schemes, loose cords or wire, low toilet seat, wheels on furniture that can move or scoot away when you want to sit down, broken equipment and beds in high position. It's worth mentioning again. Clutter, clutter, clutter. Clothing, magazines and newspapers, containers, books, boxes, pet supplies, plants, extra furniture, and the list goes on. Things we can't change in our environment we call non-modifiable, and they include cold temperatures, uneven pavement, poor public space designs such as doors that don't open properly, or low toilets in a public restroom. The things folks can change about themselves, those that are modifiable, include having their eyes checked by an eye doctor at least once a year, and update their eyeglasses to maximize their vision. They can consider getting a pair of single vision distance lenses for some activities, such as walking outside. Have a hearing exam, as balance problems can be caused by problems in the inner ear. Other modifiable conditions to be addressed include muscle weakness, gait, and balance problems. I want to mention medications again. This is where a consultation with a doctor or pharmacist might be helpful, as many of the psychoactive drugs have serious side effects as they alter the mood or the mental state. Taking 4 or more medications or any psychoactive medication increases the risk of a fall. Assistive device use. These are canes, walkers, hearing aids, and glasses. Incontinence. There are incontinence medications and products that can add assurance so that a person won't have to rush to the toilet and perhaps fall while in a hurry. Dizziness and vertigo, and postural hypotension, which is a drop in blood pressure upon sitting or standing. They can contribute to falls. These conditions can be managed to help keep a person from falling. A thorough physical exam can help the client and healthcare team better understand where a person is most vulnerable. We can't change our older age, our sex, chronic diseases like Parkinson's and arthritis, impaired mental processes such as memory, perception, reasoning, or judgment. We can't change the seizures, cardiac arrhythmias, CVA or a TIA history, or syncope. These we have to live with and adapt to. Older adults spend most of their time at home, whether it's an apartment in assisted living, their own home, or condo, so it's not surprising that about 1/2 of all falls occur in or around the home. Most fall injuries happen when the people fall from a standing height, or they trip while walking on the same level, not from falling downstairs. Certain risk factors in the home environment may contribute to about half of all home falls. Start at the entry to the home, apartment, or room and walk through each room and look at these features. Look at the steps, floor, doorways and pathways, furniture and other items sitting on the floor, the client's use of each room, accessibility of frequently used items. Look at lighting, clutter, and even pets. Is there tile or linoleum at the front or back door? Whenever you're moving from one kind of floor surface to another, the change in surface texture can put you at risk for falls, especially if it's raining or snowing outside and your feet bring some of that moisture inside to a slick surface. Have solid, non-stick areas inside any entrance to help secure footing. Is the path from the bedroom to the bathroom dark? Install night lights along the hallway, even in every outlet. Let them light your way. Are there towel racks for balance or to grab onto while getting in and out of the shower or the tub? Towel racks might not be mounted well enough to support a person's weight. Install grab bars next to and inside the tub and next to the toilet. Anyone considering a bathroom redo needs to consider the convenience of a walk-in shower. If it's difficult to stand during a shower seat allows a person to shower without getting tired or risking a fall because of dizziness. Heat and humidity in a bathroom can make you feel lightheaded unexpectedly. A chair can also eliminate bending to wash feet or shave legs. Other helps for the bathroom include non-skid strips or mat in the shower or tub. Installing a shower caddy to hold shampoo, etc. that is in front of the person so he doesn't have to turn around to reach an item off of a back shelf. A liquid soap dispenser is convenient. Fishing for that slippery bar of soap that fell in the tub can be dangerous. Have a bath mat or towel handy to step on when getting out of the tub or shower. Wet feet on tile floors are a fall risk. Are the things used most often on high shelves? Keep things that are used often on the lower shelves, about waist high. Do not put heavy items on shelves where a person has to reach up. Sliding shelves or lazy Susans in corner cupboards can help make the most convenient shelves hold more of what is used the most often. Is the step stool unsteady? Get a new steady step stool with a bracing bar to hold on to. Most fold up for easy storage and have sturdy non-skid steps and legs that grip the floor to help keep a person steady. Use that, not chairs, boxes, or makeshift items to reach high shelves. Retire the old stool. It's not an heirloom, it's a safety hazard. Do I have to add to sweep often and wipe up spilled liquids from the floor? It's good to have a light switch within easy reach of where a person sleeps. Move the lamp closer to the bed or attach a small lamp to the headboard to reduce the risk of falling, either from overreaching or from moving about in the dark. A longer phone extension cord can help bring the phone closer to the bed. Even better, a cordless phone within easy reach of the bed means you can just move the handset close to the bed. Cords are a tripping hazard. Reroute cords so they don't cross where a person walks. Pick up clutter from walkways to reduce the chances of tripping. Have a phone close to the floor in order to call for help in the event of a fall, and keep emergency numbers in large print next to each phone. Clients at highest risk should always wear an alarm device. Make sure eyeglasses are within easy reach of the bed. If a person gets up many times during the night to use the bathroom, consider placing a portable commode near the bed to eliminate nighttime trips to the bathroom. Eliminate throw rugs and runners from walkways. Throw the throw rugs away. They can slip and you can fall. Or use a double-sided special carpet tape so they don't slip. Just like higher toilets, higher chairs and armrests are helpful for easing into a sitting position. One of the potential hazards I've seen many times, especially in assisted living, is the bed covers and spreads spilling onto the floor at the corner of the bed. This is another accident waiting to happen. I've tripped on this in a client's apartment, falling to my knees. Keep the covers tucked in and off the floor, whether you or the client is making the bed. Keep objects off the stairs. Avoid wearing socks or smooth-soled shoes or slippers, especially on stairs. It's best to have an overhead light at the top and bottom of the stairs, and the list goes on and on. What I want you to see are the many little things that need to be noticed for preventing falls. I've always said that the caregivers are the eyes for what's really going on. By learning some of these basic fall prevention tips, you may be in a position to avert a fall for a client. While you are unable to install grab bars or add a light switch at the end of the hallway, you can report the necessity of doing these tasks to a person who can make it happen. I want this module to raise your awareness when you're caring for your clients, your parents, grandparents, and friends, even yourself. I fell due to the corner of the bedspread dripping onto the floor and my not seeing it, and it just took a second. Let's say Betty Barnett has been admitted to your facility, or you're going to her home to provide some assistance. How do you know she may be vulnerable for falling? Most companies have a policy and procedure for fall prevention. A critical piece of that plan is a fall risk assessment, a standardized form provided by one of several different sources where the nurse evaluates the new client's risk for falls. The Tinetti assessment tool is one such device, and there are others, such as the Morse Fall Scale, to calculate the client's ability for balance and gait and assigns points depending on their ability. For instance, on the balance scale, it asks if the client is unsteady, steady but uses a wide stance and uses a cane or other support, or does he have a narrow stance without any support? If he's unsteady, he gets 0 points. 1 point for steady but needs support, and 2 points if he has a narrow stance without support. The more points, the less risk for falling. Many assessments ask the client to evaluate his own abilities and compare that to the rest of the assessment done by the professional. It is a universal truth that people in general overrate their abilities and underrate their liabilities. Naturally, if a client has had previous falls, more red flags are raised and more safeguards need to be put into place. In such an assessment, not only is the client evaluated, but also his environment. Remember we talked about the modifiable and non-modifiable risk factors? When we can change something in the environment, such as adding a handrail or using a commode by the bedside at night to prevent a fall, we do it. We can't change a client's arthritic knee or hip, but we can offer an assistive device or personal assistance to make his mobility safer. The nurse will do a fall risk assessment for every client upon admission, but it's not one time and you're done. If there is any change in physical status, it must be reevaluated. For instance, a client suffers a little stroke or is recovering from pneumonia, he will be reevaluated. If he has been hospitalized and returns to his room or home, a new assessment will be done. Any change in medication will prompt a reassessment. Any change in the immediate environment, such as some remodeling or construction going on, will necessitate an assessment as to how the client will be able to safely navigate the obstacles. Moving to another room or unit will require assessment, as the client will need to be reoriented to his new environment. There will be a final assessment when the client is discharged and going to a new living arrangement. Despite all this advice, we know people will fall, and each fall will need to be reported and documented according to your company's policy and procedure. It is the nurse's responsibility to do the physical assessment and notify physician and family and determine the why, but it is with your input of information that she can do this accurately, especially if you're present when the fall occurs or you're first on the scene. You now have learned some things to look for in the environment that may be a risk factor for a fall, and information about the client that will make you aware of their fall risk. You should know the risk assessment for every client you care for on an ongoing basis. If that information isn't given to you, ask for it. Thank you for taking the time today to learn some tips in finding ways to prevent your clients from falling. When you are ready, please take the assessment. The references for this module are available through the listed websites for the Centers for Disease Control, the Minnesota Safety Council, and Aging Services of Minnesota.